A house call is the visit made by the clinician to perform an evaluation and exam on the patient, whereas home health visits are typically provided by nursing care, physical therapy, and other therapies such as speech therapy, occupational therapy, etc. Um, House calls take place due to medical necessity, either in the patient's home or in another facility um, outside of the provider's usual office setting. A few documentation tips for house calls. It is vital that in documenting a house calls that it is the house call is supported by medical necessity rather than convenience, either for the patient or the provider, as well as whether or not this house call is a one-time situation, a continual need, or a permanent part of the patient's care. And also within the documentation, there is an area where you will provide a place of service POS code, and in the instance of a house call taking place at the patient's home, the place of service code would be 12. There are additional codes that are acceptable for house calls, and these would be things such as a residential substance abuse facility, or assisted living or an adult living facility, and there are several others, but primarily the most common would be the patient's home or residence. Now, in discussing skilled nursing facilities or SNFs, these are going to be an admission typically prior to a hospitalization. And the requirement for SNF placement is that the patient have 3 consecutive days of hospital admission prior to being accepted into a skilled nursing facility. And that is a Medicaid rule. That does not follow the same rules under under commercial insurance policies. But your typical patients that are going to be admitted in a SNF or a skilled nursing facility are going to be your Medicare patients. So this rule is mostly for Medicare patients. Now, I just wanted to also differentiate that a skilled nursing facility is not an assisted living facility or an ALF. And the reason I make that differentiation is an assisted living facility may just be a residence where the patient has simple assistance with something such as meals or bathing and are not provided any medical care. So, a provider seeing the patient at an assisted living facility, perhaps due to a physiological condition such as, say, quadriplegia, that would actually be considered a house call because the assisted living facility is the patient's primary place of residence, and that house call is made due to medical necessity. At any rate, documentation tips for skilled nursing facility visits are, or I should say care. Um, the documentation must always reflect the current need for skilled nursing care. And if you have experience in skilled nursing facility care, you know that certification as well as recertification, there are specific rules as to how often this occurs, and it is important that with every certification or recertification, the necessity for this care is supported. And in researching common reasons for claim denials for skilled nursing claims made by providers, this is one of the most common reasons. Perhaps the certification or recertification doesn't support a current need or has lacking documentation. So this goes back to the basics of documentation and making sure that you have robust, comprehensive documentation. In addition to supporting the current need for skilled nursing, um, you also need to provide what skilled services the patient is being provided, as well as their response to treatment and the future plan of care. So, is this a patient recovering from a cerebral vascular accident who is receiving occupational, physical, and speech therapy, and how are they progressing with those therapies? Or is this a patient who is recovering from a total hip replacement requiring a little bit more extensive physical therapy and what the response is to that? In both those instances, you need to support why they're there, how they're responding to therapies, and what the plan of care is moving forward. In addition to this documentation, again, within either your templated note or forms that you're filling out, if you're still in the age of paper charting, there is a place that you will be documenting the place of service. And this needs, again, another area of claim denials is the place of service needs to match the actual location of the patient. So for a skilled nursing facility, the place of service code is 31. And if they are residing in a nursing facility that is not a skilled nursing facility, that code is 32.